Hello and welcome. Today we're diving into a rare and complex eye condition, Nanophthalmos with glaucoma. This combination presents unique challenges and requires a thorough understanding to effectively manage. Let's embark on this journey to unravel the intricacies of this condition. The exact causes of Nanophthalmos with glaucoma are multifaceted and not always fully understood. Genetic factors play a significant role, with mutations in genes involved in eye development often implicated. These genetic predispositions can disrupt the normal growth and structure of the eye. However, environmental influences during fetal development might also contribute, making the etiology a complex interplay of inherited and external factors. More research is continually being done to pinpoint the specific genes and environmental conditions that increase the risk. Nanophthalmos, meaning small eye, is characterized by an abnormally small eyeball. This small size leads to a crowding of internal structures within the eye. Specifically, the sclera, the white outer layer of the eye, is often thickened in Nanophthalmos. This thickening reduces the space for the aqueous humor, the fluid that nourishes the eye and maintains intraocular pressure, to circulate properly. The restricted outflow pathway, combined with potential angle closure due to the shallow anterior chamber, leads to increased intraocular pressure, the hallmark of glaucoma. This elevated pressure damages the optic nerve, potentially leading to irreversible vision loss. Nanophthalmos itself is a rare condition, and when combined with glaucoma, it becomes even rarer. Precise epidemiological data is limited due to the infrequency of the disease. It is observed in different populations worldwide, with no particular ethnic or geographical predilection firmly established. Because it is often genetically linked, Nanophthalmos with glaucoma may present in multiple members of the same family. Studies are ongoing to determine the true prevalence and incidence of this challenging condition. The signs and symptoms of Nanophthalmos with glaucoma can vary, but often include reduced visual acuity, particularly nearsightedness, due to the small size and shape of the eye. Patients may also experience eye pain, redness, and blurred vision as the intraocular pressure rises. Peripheral vision loss, a common symptom of glaucoma, can develop gradually, often unnoticed until it is advanced. The small size of the eye itself may be apparent on physical examination, along with signs of angle closure or optic nerve damage. Diagnosis requires a comprehensive eye examination. This includes measuring visual acuity, assessing refraction to determine the extent of nearsightedness, and examining the anterior chamber angle with gonioscopy to check for angle closure. Intraocular pressure measurement is crucial to detect elevated pressure. Furthermore, ophthalmoscopy allows the doctor to evaluate the optic nerve for signs of glaucomatous damage, such as cupping. Imaging techniques, such as optical coherence tomography (OCT), can provide detailed cross-sectional images of the optic nerve and retinal nerve fiber layer, aiding in the detection and monitoring of glaucoma. While specific classifications aren't typically used for Nanophthalmos with glaucoma directly, the glaucoma component is often classified based on the angle status, angle, closure or open angle, and severity of optic nerve damage. The Nanophthalmos itself is primarily defined by the axial length of the eye, which is significantly shorter than normal. Treatment focuses on managing both the Nanophthalmos and the glaucoma. For the glaucoma, the primary goal is to lower intraocular pressure. This can be achieved through topical eye drops, oral medications, laser procedures like laser peripheroidotomy and LPI or laser cyclophotocoagulation, and in some cases, surgical interventions such as trabeculectomy or the placement of glaucoma drainage devices. Surgical interventions in nanophthalmic eyes are complex due to the thickened sclera and risk of complications, like uveal effusion. For Nanophthalmos itself, refractive correction with glasses or contact lenses is used to improve visual acuity. Careful monitoring is essential to detect and manage any complications. Currently, there are no definitive preventative measures to stop Nanophthalmos from developing, as the condition is often related to genetic factors. Genetic counseling may be considered for individuals with a family history of Nanophthalmos. Early detection and management of glaucoma are crucial to prevent or slow down vision loss. Regular eye examinations, especially for those at higher risk, are vital. The prognosis for Nanophthalmos with glaucoma varies depending on the severity of both conditions and the effectiveness of treatment. Early diagnosis and consistent management of intraocular pressure offer the best chance of preserving vision. However, due to the complex nature of the condition and the potential for complications, vision loss is a significant risk. Recent research focuses on identifying specific genetic mutations associated with Nanophthalmos and developing gene therapies. Advances in surgical techniques and glaucoma drainage devices are also improving outcomes for patients with this challenging condition. Continued research is essential to finding better treatments and, eventually, Preventive measures for nanophthalmos with glaucoma.